Hello, guys. Welcome again to Switch India's breast cancer awareness session. So, as discussed previously with Dr. Jenny, we got an idea about what breast cancer is and how it is a life alternating disease. And simple education about it can help in the treatment outcomes and also help in the prevention of the disease. So, today in the part two, we have another expert from the medical fraternity, Dr. Rohit. Hello, doctor. I welcome you on behalf of Switch India. Dr. Rohit is going to enlighten us on the topic of breast cancer awareness today.
Okay, thank you, Prachi, for this lovely introduction. And thank you mostly to Switch India for this campaign, first of all, and then secondly, giving me a chance to speak about it. Yeah, that's about it.
So, doctor, can you tell us about what breast cancer is? What are the signs and symptoms of breast cancer?
Yeah, totally. So breast cancer is nothing but a cancer which is like abnormal growth of a breast tissue, and breast tissue could be your fibrous tissue in it, or your lobes, lobules, and ducts, and all this. So any of these parts could get cancerous, and which is like uncontrolled growth, and which could manifest as a lump, or maybe a rash, or maybe abnormal discharge, which could be yellow, red, blood, or anything. Or in extreme cases, your skin of the breast superficial one could also be involved, where you could get a dimpling or some sort of pores or something. So like any form of it, anything abnormal shape or size, it could manifest that.
So, doctor, are there any specific risk factors associated with breast cancer?
Yeah, definitely. As like with any other disease, it has history and risk factors. So mostly it is like 99% of the cases, it's women. So that is one of the risk factors. And then age is also considered one of the risk factor, because it's mostly seen in upper and middle age. After that only, fewer cases in youngers, but not to be ignorant about it, obviously. And these are the chief ones. But then after that, there will be scientific ones, say more estrogen exposure. It could be OCPs, or more, not to scare you of OCPs, but these should be in balance if long-term exposure is there. And then obviously early age of menarche, or late, first child born, because there will be more exposure to estrogen in that case also. And then there are family history and genetics also, BRCA1 and BRCA2 and P2053. Those are chief, things.
So, doctor, I would like to ask why nowadays so much of importance is given to the education of breast cancer?
Okay, yeah. So it's really important. I mean, this pink month has been started like probably 90, 80 years back only. And yeah, there was a need of the art back then also, and it's still the same. Obviously, we have come a long way, but still women are being diagnosed with it, and there is a high chance of mortality also. So with such events, we are bringing into attention the fact that if diagnosed early, there is a chances of better survival. So with these events, we are just telling them that there are four, 5 stages of breast cancer, and with each stage, the survival risk, survivals are reducing. By that, what I meant that if you detect the cancer in stage one, then there are, say, above 95, 96% of 5-year survival. So obviously these are better odds than the stage four, where if it's detected late, then most likely only 20 to 25% of 5-year survival is there. So these numbers are scary, and obviously globally it's a different picture. India, it's a different picture, but even in India, it's one of the most prevalent cancer in women also. So yeah.
Doctor, what are the numbers of breast cancer? I mean, the statistics globally.
Okay, yeah. So globally, we can say that about 2.3 to 2.4 million women are diagnosed. By 2020, we had that number. And with the death, like I guess around 700,000 women died globally by then. And when it comes to India, numbers are a little hasty around, but whatever we know as of now is it's one of the most prevalent cancer in women also in India. So numbers are really high here. So that becomes the basic, like why is it happening? Because most women are getting diagnosed in the later stages, and then the treatment obviously modifies, and then the risk is more there. So there comes the part where we have to create such awareness programs where information is dispensed in a way that they become more aware that, okay, to detect the cancer in earlier stages.
So, doctor, in the previous video, we got insights upon the self breast examination techniques. So, are there any other diagnostic methods for breast cancer?
Yeah, totally. Like if there is just a lump or abnormal discharge, then you have to do a self-exam. Even before that, monthly, you are supposed to do a self-exam check. But you just have to check it if there is another lump or something with your fingertips, and you can do it once in a month or once in a half a month. Then, other than that, if you have to get into the hospital and get it checked there, then we have mammography and USG, and it can go into later intervention also, FNAC and MRI. But it's very subjective who needs which one, and you probably don't need the extensive one if you detect it early, if you have symptoms, like you have caught on to the symptoms earlier. So mostly it is seen that if women is before 30 years and she's experiencing any abnormal discharge and any lump, then we avoid any radiation. So we'll go for ultrasound breast, and we'll check if the lump is, or what sort of lump is that, and then we proceed from then on. But if a woman is greater than 30 years, then we can start with the mammography. It's simply an X-ray of breast. So it is best screening tool out there. Just the age is the number barrier there. So yeah, mammography is ideally started there. But if you have a family history of breast cancer previous, then you can start the mammography before the norm age also to check. And then it's a different picture altogether. Once there is a mass detected with mammography or USG, then you move on to confirming the breast cancer, because it can just confirm that there is a mass, but we don't know if it's a benign mass or a malignant mass. So after that, we can go for an MRI or MRI guided, a crew cut biopsy, or where you just pierce the tissue and get a simple tissue out of it. And then we view it under the microscope simply and check if it is a normal breast tissue, or there are some abnormal activity happening.
Coming to my final question, doctor, what is the treatment of breast cancer?
Okay, yeah. So it's important not to be scared about if there is extensive treatment. It all is very curative and very much subject dependent, what sort of cancer you have. If you already have a family history, then it's different than if you are the first subject of it in your entire family. Then if you had a family history, then prognostically, you, even if it's not manifested, one could go for bilateral mastectomy, where you can remove your breast prophylactically, so that the cancer doesn't manifest in those tissues because you had a family history. So you can remove that. And if your doctor feels like, because some genes like BRCA1 is also related to not just breast but some uterine tissue also. So sometime in extensive cases, you feel the need to remove your uterine. If your family is complete, uterus is, you can remove that just to avoid the risk of getting in future. So that's rare cases, or if you want to go extra mile with that. But in normal cases where you have just a lump, and you are just worried, and after the entire diagnostic thing, if it's actually a breast cancer, because normally there could be lump which are harmful or harmless. So if it's a harmful lump, then you could go for lumpectomy, where you just remove this bit of whatever bit is surrounding the lump, and then surrounding little bit of tissue with it. So that's their totally conservative management. And in other cases, if it has spread a little bit, then you can remove the entire breast, which is called radical mastectomy. In that case, we just remove it so that it doesn't spread beyond that. So that, and bilaterally same, sometimes you can remove both the breasts. There is that. And these are surgical things, but then other than that, conservatively, we also manage it with radiation, where you just radiate the area specific things where the lump is, so that it could die because of the radiation, and you don't need to go for these surgeries. And then drugs are there, chemotherapy, like estrogen modifying agent, hormonal ones. Those could be taken, or the combination of either of them. Sometimes radiation is given first, and then the treatment is there for drugs and all. So that's important.
So basically, breast cancer is curable when people are educated about it, and that was the whole point of this call. And I think you have provided valuable insights to our viewers on the subject of breast cancer, and I really thank you from the bottom of my heart for this.
Thank you so much, Prachi, for this. And obviously, like you said, treatment is comes later. This is for mostly for education, so that you can detect it earlier and earlier, and the treatment doesn't go that far. And mostly, breast cancer is doable. Like it's manageable so well that if you detect it early, then you can. So that's where your self exam comes. That's where your early diagnosis comes. So thank you for this chance again.